Hi, my name is Abby Dye. I am Mayor Pope's assistant here at the City of Lubbock. Welcome today for our COVID-19 City of Lubbock press conference. Today, we have a few special guests who have not been on our press conferences yet. They'll be answering some questions and allowing us to get a different perspective. So today, our panelists are going to be Katherine Wells, who's the director of our health department, Dr. Ron Cook, who is our local health authority, Councilwoman Sheila Patterson Harris. She is the council member over District 2. Juan Chavez, who is the council member over District 1. Mayor Dan Pope of Lubbock. And then at the end, during the Q&A time, we'll have Dr. Joe Cordero, who is the department director of otolaryngology at Texas Tech Health Sciences Center. So I'm going to turn it over to Katherine Wells to give us an update.
Thanks, Abby. Today, I am going to update you with the current numbers of COVID-19 cases here in Lubbock County and the ongoing activities of the Public Health Department. The Health Department is reporting 575 cases as of yesterday evening, May 6th. The department is pleased to see the number of cases remaining steady. However, although the number of cases has remained steady, it is too early to determine if the opening of businesses and the relaxation of some of the rules has any impact on our local numbers. On average, it's going to take around 7 days for someone to develop symptoms, and then it may be another 3 or 4 days before they get tested and for the results to be reported to the health department. If this opening is going to make a difference, we will begin seeing that effect in our numbers next week. The health department also continues to report recoveries each day. There are currently 283 individuals recovered in Lubbock. The average recovery time that we're seeing is about 18 days, with some individuals taking over 40 days to recover. The health department uses the CDC symptom-based strategy to determine when someone is recovered. And for the majority of the population, this is recommended. There are some special populations where we will look at other ways to mark them as recovered. And I also want to remind people that most of us don't need a second negative test to return to work. This symptom-based strategy is now considered the CDC's standard. We also unfortunately continue to see deaths reported in Lubbock. There are currently 47 individuals that have died due to COVID. The department also wants to point out that 3 of the last 4 fatalities noted in Lubbock are not residents of nursing homes. These are individuals who were exposed to the virus through contact with an individual in the community who was either a asymptomatic carrier, a caretaker, or family member. This is why it is so important that we need to continue to limit gatherings, practice social distancing, staying home if we're ill, and following good hygiene practices. As we approach Mother's Day, don't let your guard down. We need everyone to follow the guidelines to keep our case counts down. I hope you all have a happy Mother's Day. And please stay healthy and safe. And I'm now going to turn everything over to Dr. Cook. Thank you.
Thank you, Katherine. I appreciate that. It looks like we're going to have another beautiful weekend for Mother's Day. There have been lots of questions forwarded to us about Mother's Day and seeing your loved one if they are in a nursing home or a long-term care facility. Unfortunately, the governor's order says those places continue to be on lockdown. My heart goes out for you because I know you care greatly for your loved ones, especially this weekend when we're celebrating Mother's Day. But this is not the time to buck against the system and approach the nursing home, because these are a very vulnerable patient population. You know, I speak from experience because my mother was in a nursing home for a number of years. There are many reasons why we put our loved ones in these facilities, primarily because we want them safe. There are medical reasons such as Maybe they're recovering from a heart attack. Maybe they're recovering from a prolonged hospital stay and they just need to be there to get their strength back. Maybe there are physical reasons, like they had surgery, they had a hip replacement, and they need to be there until they get strong enough to go home. And then perhaps they're there because they just cannot take care of themselves. Say, perhaps they have Alzheimer's or some other dementia-related disease where they're just not safe at home because they wander, they're not able to cook well for themselves. So we put our loved ones in these facilities because we want them safe. We want them protected. We want them fed. We want them bathed, and we want them cared for, and we want them safe 24/7, 24 hours a day, 7 days a week. And the last thing that we want to do is jeopardize their safety by exposing them to this virus. This patient is exceedingly vulnerable to this virus, and that's evidenced in our own community just a few weeks ago. We can be asymptomatic carriers and carry it to them, and then all of a sudden it explodes and runs rampant through the facility. Please know that my heart hurts for you if you have a loved one in one of these facilities and you can't go visit them. Send them flowers, send them cards, do things like that, that they know and that you still love them. Unfortunately, it's the governor's orders. And as the health authority for the city of Lubbock, I'm charged with the well-being of the community, and especially for very vulnerable populations such as this. So at this time, we just can't visit them person to person, and I'm sorry for that. For the rest of us, we need to make sure that we continue our social distancing as we celebrate Mother's Day. Make sure you wash your hands. If you're sick, have the sniffles, please stay home, stay away from other individuals. We don't need to spread the virus. We're doing pretty well so far, as Katherine pointed out, and as I think the mayor's going to go over some things too. Please stay away from those individuals. If you're sick, stay home, wear a mask, keep your social distance. Happy Mother's Day as you celebrate it this weekend. Have a wonderful weekend. That's all that I have. Abby, back to you.
Thank you, Dr. Cook. We appreciate you. Next, I'm going to turn it over to Councilwoman Sheila Patterson-Harris, who is our representative over District 2.
Thanks, Miss Abby. Good morning, all. And I first want to say thank you for you all allowing me to be a part of this 2 Live crew that's been taking place for several weeks now. I pray that all is as well as it can be for our citizens. And I want to begin by talking about the Bobby Jean and TJ Patterson Branch Library. Right now, it's serving as one of the COVID-19 testing sites for citizens. This is the only City of Lubbock facilitated testing site that is up and running at this time. At present, it's operating on Mondays, Wednesdays, and Fridays from the hours of 1 to 6 p.m. It does, however, require an appointment be set and a completion of a brief questionnaire for testing, much like it would take place if you were going to get care at your doctor's office. It's also at no cost. Let me say it like this, guaranteed no cost to citizens. So if you have insurance, it will be billed to the insurance company, but at no cost if you do not have any insurance coverage at all. You know, while testing is being administered at Patterson Branch, there's no curbside service there for the patrons, but there is available for the Patterson patrons home delivery services where requested materials like you would do with curbside service will be delivered to your home. And the contact number to make that happen for you is 806-775-2851. Again, that number, 775-2851. You know, since testing began last Wednesday at Patterson, there's been a total of 69 tests administered, which is great because what we want to do is make sure that citizens have access to testing. I want that no one is not be able to be tested if they're desiring to. I want to also point out that this past Sunday, the CDC implemented some new guidelines for COVID-19 testing And what it does, it establishes some high priority testing for individuals who make up a specific minority groups. These are groups of persons that may not have symptoms, who have come or fallen in line with racial and ethnic minority groups that are disproportionately affected by adverse COVID-19, the outcomes that we're seeing. Currently, those groups are African Americans, Hispanics and Latinos, some American Indian tribes, specifically the Navajo Nation. And so we want to make sure that these citizens are being provided the opportunity to get tested, even if they're not having any symptoms. With that being said, I want to encourage and direct citizens who make up these identified groups to the Patterson Branch Library for testing. If you desire to be tested, that is, it's available for you. And if you're within these specific groups, I want to also make sure that we provide the actual number for those groups. You can contact, and let me get it here because I want to make sure I have the right number, the number for the health department. And I'm not finding it on my phone, and I apologize for that, but I'll make sure that we get that for you so that you can make those appointments and get in line for testing. Before closing, I do want to say again, I want to encourage citizens as we make our way to Mother's Day weekend, that we make sure that we continue to be safe and follow the CDC guidelines to help us keep ourselves safe, as well as those who are around us, especially mama. I'm going to be passing it back to you, Abby, but I want to say again, encourage people to be safe, take advantage of the testings. If you're in those specific groups, take care of yourself and stay safe.
Thanks, Councilwoman. We appreciate you having you on the press conference today. It's always good to see your face. Next, I'm going to turn it over to Councilman Juan Chavez, who is our district representative for District 2.
Thank you, Abby. I'm going to, voy a dar unas cuantas palabras en español, tratando de enviarles el mensaje que tenemos que tener mucha precaución con nuestros seres queridos, o especialmente que va a ser la fiesta de las madrecitas. No queremos estar celebrando y al mismo tiempo posiblemente pasar el coronavirus a nuestros seres queridos. Les pidamos que si se van a reunir, que por favor no sean más que unos 10 personas y mantengan su distancia social. Es muy crítico, por favor, les suplicamos. Y con eso dicho, quiero leerles unos mensajes del Departamento de Salud de nuestra ciudad de aquí de Lubbock. Les digamos que se laven las manos con agua y jabón con mucha frecuencia, que se cubra cuando tiene la tos o va a estornudar con la manga de su brazo o con un pañuelo. Evite tocarse los ojos, la nariz, la boca, si no se ha lavado las manos. Otra vez, es muy importante que siga lavándose las manos. No le podemos decir la importancia de eso. Si sale para la tienda para comprar algo, al entrar de la tienda siempre tienen ahí donde se puede lavar las manos, y al mismo tiempo en salida del edificio ese se puede lavar las manos otra vez. Pero al llegar a la casa, lávese las manos otra vez, porque nunca sabemos si contagió o no el coronavirus. Y le suplicamos también que siga teniendo su distancia social. Otra vez es crítico. Y si sale, decimos que se ponga una máscara facial para protegerse usted, pero más que nada para proteger a nuestros vecinos, personas que andan por la tienda de compras. Y si siente usted que tiene problemas, sea con el coronavirus, si está teniendo problemas, digamos, si tiene fiebre, tiene tos, o está batallando con el respiro, o está vomitando, tiene diarrea o le duele la garganta, puede llamar al Departamento de Salud de aquí de Lubbock al 775-2933. Otra vez, el número ese es 775-2933. Le van a hacer unas preguntas bien sencillas, igual como si fuera para la oficina del doctor, del médico. Estos requisitos es para garantizar que se le va a dar la ayuda medicinal que necesita. Nadie más es rechazado. No le van a cobrar ni un centavo, porque queremos que toda la gente de aquí de esta comunidad, que ganemos esta batalla con la coronavirus. Otra vez, el número del Departamento de Salud es 775-2933. Solo que con eso dicho, por favor, límite su fiesta este fin de semana. Si es posible, llámele a su abuelita o a su madrecita, que le dé felicidades este fin de semana por este día tan especial. Pero vamos a no contaminar a nuestros seres queridos con el coronavirus. Con eso dicho, la siguiente persona va a ser el mayor Dan Pope. Thank you. Gracias.
Good morning. Thank you so much, Juan. I understood a bit of that. I do think you spent part of your time talking about what a great council you serve with. And I'm thankful for you and for Ms. Patterson Harris and for getting the word out. And I know that it's nice to hear different voices, and I really appreciate both of you today. I do want to fill in the blank, and I know Sheila will probably remind you of this in the question and answer, but that phone number for our health department is 775-2933, 775-2933. I appreciate Dr. Cook spending a bit of his time today talking about our senior adult centers, our long-term care facilities, nursing homes, memory care. Those are the people that live in those centers are so important to us. In fact, we were on our public health call last night, and the county Judge Parrish joins us for those calls, and he reminded us last night that both his mother and mother-in-law are in these facilities, and they haven't seen them in now nearly 2 months. But the way that they're able to work through that is they know that they're in the spot where they need to be, where they're very safest. And so we just ask that we pray and we ask for your patience and your love. And the very best thing we can do for those residents is limit access to them right now. I want to share my screen and share with you some of our data. Pardon me. I want to share our data slides as you're getting used to seeing these from me. And the first 5 slides, but by the way, these slides are on our City of Lubbock webpage. The first 5 slides talk about the COVID-19 and how it's impacted us demographically, age, race, sex, where you live. So I guess demographically, and that would include geographically. And these are updated on a daily basis. I just want to remind you that if you'll go to mylubbock.us, click on our coronavirus link to the health department site, that's where you'll find these slides. Okay, let's go to the 3 slides that we've been watching closely, and then I've added another one today to look at. So active cases. So remember that active cases is total cases less recovered cases and less any deceased. We want this active case trend line headed down like it is. We feel very good about this. Second is new cases by day. And I'm going to put a different perspective on this in just a minute. But once again, our new cases about our this week we've been all week long less than 10 new cases on a daily basis. Hospital capacity, our you know, what kind of capacity do our hospitals have? Notice that this capacity is getting smaller. That's okay. Our hospitals are beginning more normal operations. Focus on the blue line at the bottom, however. That's your COVID-19 inpatient population in our local hospitals. It's remained very steady, right around 30 patients a day. Finally, this is our newest slide, and this is a bit of what the governor talked about earlier this week. And so the blue lines are our tests administered on a daily basis. And if you go back to the beginning of you go back a month ago, that on Monday, April the 6th is where this begins. And that week we only had 2 days that we tested more than 200 people. Well, the last week we've tested 300 or more people. I guess 4 out of the last 7 days. So you see the trend on testing growing. We've talked a lot about that. More importantly are our new cases. That's the orange line or the red line at the bottom. So even as we're testing more people, our total positive tests are going down, and they're staying down. And that allows us to really understand that we are gaining on this and we're in a good spot. And it's one of the decisions that allows us to go back to my this allows us to feel better about safely reopening Lubbock. Remember the Lubbock Safe. I'm so thankful for our task force and the work that they're doing, because I looked at some polling just this morning that was done yesterday, and more than half of our citizens in the country are comfortable going to a grocery store. However, only a third of our citizens feel comfortable going into a retail store. And just a little bit more than 22% of our citizens feel good about going into a restaurant. Now, that's going to improve as people realize that we can safely go back into our real world. And we believe that a big part of that is through this effort with Lubbock Safe, which allows our businesses to voluntarily step up and say, we will adopt these sanitation and safety standards for our employees and for our customers. And so we're so pleased that is continuing to grow. And thank you to our businesses and thank you to our citizens for shopping and eating in businesses that are Lubbock safe. Okay, finally, a little perspective as I wrap. As a community, we've recovered before. Very few of us remember the Great Depression, but Lubbock worked its way through the Great Depression. Many of us, though, will be thinking a lot about May 11th, 1970 over the next few days. Remember that was the day of the Lubbock tornado, 50 years ago from this coming Monday. We recovered together, whether it be the Great Depression or the Lubbock tornado. Let's not lose that perspective. We've been here before, and together, we recovered. We summoned that West Texas spirit. We loved our neighbors and our families, and we put one foot in front of the other, and we got better every day. That's where we are right now. I look forward to being with you next week, and happy Mother's Day. Back to you, Abby.
Thank you, Mayor Pope. Now we're going to open up for some Q&A. First up, we have Ms. Olga Aguero with El Editor. One second, Olga. Olga, are you there?
Yes, ma'am, I'm here now.
Okay, go ahead.
Thank you. Good morning to all. It's great to have Sheila and Juan with us this morning.
Here, here.
And thank you, Katherine, for providing me the information that I needed from Monday's conference. And with that being said, I just want to bring up the breakdown as for the positive cases on the long-term care as nursing homes and all that. And since Sheila and Juan are here, I think it's very important that we know that percentage. It's 30% Hispanics, and it's 9% Black and white, 47%, and unknown, 14%. That is, you know, that is high just for the senior living. So that tells us a lot within the Hispanic community. And I just wanted to throw it out there and make everybody aware that, you know, those numbers are high. We need to take care of our senior citizens, our parents, and I have just a quick little shout out before I just gonna ask one question since I'm saying all this, is to all the essential workers at Covenant and all the hospitals, UMC, especially being Mother's Day this weekend. We really appreciate them. We love them. On top of all that, of course, our doctors and our nurses. But a shout out to all those essential workers. Mayor, I wanted to ask you, sir, Lubbock sees this task force, regardless if it's popular or not. What would it take for you to dismantle or to dismiss this task force, which is very fortunate that Lubbock has?
We haven't even thought. Thanks for your question, and by the way, thanks for your comments. I echo your comments. We haven't even thought about dismantling the task force. We're still, in fact, as we are meeting right now, one of the subcommittees, the education subcommittee of the task force, is meeting right now. They've got a lot of work to do as we think about the fall and we think about school. So let's talk about that in 60 or 90 days, but we've got work to do right now, Hugo.
Thank you.
Thanks, Olga. Next up, we have Brady King with Fox 34. Brady, are you on and ready? If not, I can add you. Okay, Brady, do you have a question?
Yes, good morning. I wanted to follow up on something that was mentioned before. What were the ages of the 3 COVID-19 deaths that you mentioned were not in nursing homes? And could you explain how they were exposed to the coronavirus?
This is Katherine. I don't have the specific ages in front of me right now. They were all older individuals, but again, it shows that how easily this virus can be spread within families and with close contact, and that's why we need to make sure we continue with our social distancing.
Great, thank you. And for Mayor Pope, with sales tax revenues down 5% for March and the controller expecting a much larger drop for April, have any changes been made with the city's budget?
Yeah, great question. I appreciate you asking me that. I think we've done 2 public briefings in work session of city council meetings about the planning we've done about our budget. And interestingly enough, we planned for those sales tax revenues to be down 10%. And we were told, we learned yesterday they were down about 5%. So we will continue to plan. And I would expect that you would see a more in-depth kind of update being done very soon for all of our citizens to see. But we are in good shape. And, you know, sales tax is a big part of our revenue, but we have a lot of other revenue streams also. And we'll continue to provide the services that all of our citizens expect.
Great, thank you.
Thanks, Brady. Next, we have Ms. Sarah Self-Walbrick, and she is with Texas Tech University Public Media. Sarah, are you ready?
I am. Can y'all hear me okay?
Yes, ma'am.
Wonderful. My question's also for Katherine. I also want to talk a little bit about long-term care centers. Those numbers had kind of leveled off towards the end of April, but we've seen 7 new cases connected to these facilities in roughly the past week. So can you offer any just kind of an update on what the current situation is at these facilities, and have there been any new centers that have been exposed recently?
Yes, we've had two, fairly large outbreaks in two of our facilities, and we've talked about those extensively. And we've been able to get everybody in those facilities tested and working really hard on isolating ill patients from those who are not infected. We do have a smaller outbreak that has shown up this week, and that is in a smaller assisted living facility. And we're currently working with that facility to get those ill individuals isolated into their own rooms to prevent any further transmission.
Wonderful. That's all I have. Thank you.
Thanks.
Next, we have Ms. Christy Martinez Garcia with Latino Lubbock.
Good afternoon, everybody. Since only 1% of Americans have been tested, which I believe is also the case for Lubbock, do you believe that we should even continue COVID-19 testing? And I do want to know who among you have been tested for COVID-19?
Well, let me start with the data question first. Just under 3% of Lubbock County has been tested. That's a little less than twice the state average. I think it's about 1.5% of the state has been tested. So those are the updated numbers. I have not been tested. Dr. Cook?
Certainly. Thank you, Christy. I think, yes, it's absolutely, we should continue testing. If we had all the testing capability in the world, this would be a great thing to do, because then we can, as I've mentioned in the past, when we test people, we go out and look for pockets of, ideally in this particular virus, asymptomatic carriers. So then we can find that person that's carrying the virus who may not have symptoms, but we can isolate that individual so that they don't spread it any further. That's the best situation. I have not been tested yet. A number of my colleagues have been tested, especially those that have been on the front line. I've worked in the hospital, but the way the two hospital systems are set up, we have dedicated individuals who are dedicated to make sure they take care of the COVID patients that are in the hospital. We do that because it limits the amount of PPE, personal protective equipment, that we use because we're still in a national shortage of all this PPE. And so we're not burning through a lot of equipment like that. So it limits the amount that we use. And then those individuals are on the front line. When I'm on the hospital service, I'm taking care of those individuals that are not infected with COVID, the heart attack patients, the stroke patients, the diabetic patients, those sorts of things too. Let me also introduce a colleague that's on the news here, or on the screen with us today. It's Dr. Joe Cordero. He is fluent in Spanish, and he's an ear, nose, and throat surgeon here at the medical school. So if there are some questions you would like to direct at him, please do so.
And I do have one more question. Are you ready?
Yes.
Yes.
So, and Dr. Cordero, it's so great to see you. I have a lot of respect for you. My question is, this is the question, because obviously there has been a lack of cultural competency. And if anything, I believe that this experience, because everything seems to be reactive, should probably be used for future issues of any kind, any campaigns that the city does. That's my commentary for that. But I would like to know from here and thereon, how are you going to be more effective in making sure that you engage all the community, especially the communities of color, which sometimes have felt like they are not connecting with the leadership of this community? And I guess, Mayor Pope, you can answer that question.
Thanks, Christy. I think that's a great question. I think maybe there's no better witness to our commitment to communicating and doing it better than the way we're running this information session today. We are trying to bring different voices and faces to this. And we're so thankful that Councilman Chaitis was able to join us today and to deliver his thoughts in Spanish. We can do better. There's no doubt. Yes. That's something that we're committed to. And I would expect you would see us continue to get better in that regard. You remember, Christy, that it was only at the beginning of this situation we find ourselves in now that we started having our signers, our folks that are able to communicate with our hearing disabled part of our community. So we are getting better, and we'll stay committed to that.
If I'm still on, cultural competency is a very critical term. And I appreciate that you have the interpreter, but just even as we were on here, I had an individual ask, they should have had a sign person for Spanish. I appreciate that Councilman Chidas did that message in Spanish. That was wonderful. But it is important that from here on, I think, Mayor, that all of anything that the city does needs to be culturally competent. Thank you.
Thanks for your input.
Thank you, Christy. Next, we have Terry Furman from KLBK.
Good morning or afternoon now, everyone. My question is this. I am an optimist through and through, but the devil's advocate in me has to ask. Oh, don't wipe your sweat away. That stresses me out. Okay.
I'm not sweating. I'm actually scratching my forehead, but Dr. Cook says not to touch my face, so I'm doing it with my handkerchief.
Very good. Very good. Have we thought about, and I'm sure we have, if the cases do spike in Lubbock, are we prepared to take a step backwards?
Sure, we've thought about it. We talk about it all the time. The governor talked about it on his press conference this week. That's why we are starting the restart, the phase in, warm up, whatever we want to call it, is going slowly, and we want to make sure we're able to do it in a safe way. Those are my thoughts. I'll let Dr. Cook and comment on that also.
Certainly, I think Terry, we need to be careful. We're watching the numbers. I do expect them to rise, but as far as in that, I am comfortable with that. We know that as people get out and interact with each other, and some individuals don't believe that this virus is very infective or going to concern them, but I think we'll see our numbers rise, and as they do, we'll watch our hospital capacity and ability to take care of those individuals. Pardon me. And if it becomes close to overwhelming again, then we're going to really have to shut the doors again. And that's just all there is to it. People don't believe that this is any worse than the flu. It is. It's absolutely worse than the flu because it can infect and overwhelm a population of individuals, especially and we've seen evidence of this already in our own community, that it could easily overwhelm a group of individuals. And if that occurs, we'll have to take measures to reel it back in. So all that saying, everybody needs to do their job to make sure they continue washing your hands, social distancing. I strongly encourage wearing masks when you're close to each other, especially on the weekend on Mother's Day. So.
All right, thank you. My second question is this. It would be so great if Lubbock could have huge Independence Day 4th on Broadway celebration. I know that the committee is really working hard to make that happen. Will there be, I'm sure there will be changes, but can we foresee any changes that could be made to the 4th on Broadway celebration?
You know, Terry, it's a great question, and it's very timely. In fact, I'm spending some time with Don Caldwell on Monday of next week. I would assume that we would talk about this as a group at some point and give some guidance. There's a lot of planning that goes into that. We certainly want to have it this year, and just let us get an answer, but we're not quite ready to announce anything on that yet.
All right, very good. Thank you all for what you're doing.
Thank you, Terry. Next, we have Adon Rubio with the Daily Torador.
Hello, everyone. I guess just for my question, really, with businesses or cosmetology type businesses opening pretty soon, I was just wondering, as of now, have you heard what has been the response of those businesses toward being a part of the Lubbock Safe program or possibly registering under the program?
I think it's probably a little late or a little early to give you a lot of numbers on that yet, Don. I do know that a number of them are very interested in being part of it. In fact, the protocol, the safety and security procedures that were put in place with the frankly, from the industry. They're the ones that know the most about it. They work closely with our recovery task force to develop those. And so I would imagine that, like our other businesses, that they will adopt and volunteer to be on that, as part of Lubbock Safe. I'll try to have some better numbers on Monday as specific to that. Okay.
All right. Thank you. That was it for me.
Thanks.
Thank you, Adon. Next, we have Nicolette Perdomo from KMAC.
Good afternoon, everybody. If you are able to hear me, thank you so much for allowing me to join. I want to ask about our community spread cases. I think this would probably be for Katherine. Of course, right now, since the governor lifted everything last Friday, we are seeing people more out and about, but I want to focus more on, at last count, we believe there were a little more than 80 community spread cases. And just kind of going back to that, can you break that down for us? Specifically, any details on what we've seen so far, how those community acquired cases are being spread through your investigations, and kind of just how people are getting it more from their workplace, or if they're out and about in the community and that's how it's being spread.
Okay. And we have two different categories that look at individuals who have contracted the virus through some kind of community interaction. So the first one's exposure to a known case. That means that we know exactly, we know they have a friend, a family member, or somebody at their work that was positive, and we know that that's how they contracted the virus. The community spread are really the ones where we don't know where that individual contracted the virus. We've gone through our investigation. They don't know anybody that's positive. We don't know anybody that's been around them that's positive. So those are really our question marks. We don't know if they got it at work or at a store or out in the community. They've just tested positive and we don't have an answer.
Okay, thank you so much. Just a quick follow-up. Have there been any specific cases or evidence through your investigation that a customer of a local business has contracted coronavirus while visiting or shopping there?
The majority of the cases, when we know the exposure to known case, we see them mostly in households or individuals that work closely together. So there's really a time essence in there. So usually they've spent time with a sick individual and are now positive.
Perfect. Thank you so much. I really appreciate that.
Good.
All right, next we have Matt Dotre with the Lubbock Avalanche Journal.
Hey everyone, nice to see some new faces on here. Councilwoman, I wanted to ask you a question, Ms. Patterson-Harris. You said about 70 individuals have been tested at the Patterson Library. Can you give us your thoughts on that? Is that more or less than you expected? And how can we, get more individuals tested there?
Thanks, Matt. Hey, thanks for recognizing that there's a new good-looking face on as a part of the 2 Live crew. I really didn't know what to expect, Matt. Actually, once we opened it up, my biggest desire was that people would, if they were having symptoms, make their way to the location, specifically if they were having difficulty making their way to the other locations. I just wanted folks to get tested so that we could begin to have some information that we otherwise may have not received. So I wasn't surprised or disappointed. I'm glad that people are utilizing the site. I anticipate, especially with the new CDC guidelines, that the numbers should increase. I hope that they would. As stated earlier, the concern is that there's so many possibly so many asymptomatic individuals out there that are carrying this thing. And the fact that the new CDC guidelines will allow those folks in those specific groups to be tested and help us understand how this thing is moving or what it's actually been doing in some of the areas. So I'm just excited to have it. I think the way that we get people there is begin to carry that message. Make sure that people know as you're having your conversation, share it with people, ask those questions. I think we get the word out through churches, through pastors, and make sure that they share them as they're on live with their congregants and all of that. So I'm anxious to see what is actually out there. I think that's been our concern. We've not had enough information.
Mm-hmm, mm-hmm. Very good. Thank you. And Dr. Cook, I wanted to ask you about the antibody tests. So Covenant said yesterday that they were testing citizens. So I would imagine that some people are going to find out that they maybe had the virus a few months ago, or that they find out that they already had it. So what's kind of your advice to those people? Is testing, is an antibody test showing that someone had it, showing that you already had it? Is that kind of a free pass to go back to normal?
Well, so let's talk about the two kinds of tests. One is when you may or may not be symptomatic, but you have the virus running around in your body. And so that's the nasal swab or the finger stick that we're testing for the antigen. You're actually testing for the viral particles, the RNA of the virus. And so that shows acute infection. There are two types of antibodies. There's an IgG and an IgM. IgM is the one we make first. There's not enough testing supplies out for that one. That one's not been released yet. So the next one is the one that we provide that's called IgG. And IgG antibodies are the ones we think are going to provide you the immunity to the virus. Now, that's a very early statement. So Covenant's doing that one right now. UMC is doing that one for patients that are being tested for surgery or for frontline workers to make sure that they have immunity when they go back on the front line. We've tested a number of individuals in the healthcare industry so far, but very few have antibodies to it. So that tells me, in short, that tells me that they didn't get infected, and we're doing a pretty good job of protecting ourselves with the personal protective equipment. So IgG gives you some immunity that you won't be infected again. We don't know that absolutely for sure. So let's take the flu virus. So when we build antibodies to the flu virus, or we get the vaccine for the flu virus, we create antibodies to help prevent us from getting the flu. However, because of it mutates over the course of the year, those antibodies don't last very long, and we have to give you the flu vaccine next year. However, if I give you the measles vaccine, or if I give you the polio vaccine, or the chickenpox vaccine, those are typically one time or maybe twice in a lifetime doses, because they last many, many years, decades. And so at this point, it is way too early for us to even determine whether or not, if you build your own natural immunity to the disease, how long it's going to last. And those will be studies that will be pending over the next several months to years. And so, but the whole purpose of the vaccine is to build up those antibodies so that you don't get the infection. So hopefully we'll see how long this one lasts. They'll do the studies and help us determine those.
Interesting. Thank you.
I mean, I had a member of the hospital faculty that never knew he was even sick and tested positive for the IgG. So somehow he got exposed, was not symptomatic, may have spread it to others, we don't know, but he has immunity, or has the presence of IgG. We hope that confers immunity. Hope I answered your question, Matt.
You did, thank you.
Hey, Abby, before you go, I want to try to answer Adon's question from earlier. As of just a few minutes ago, we'd had 8 personal services businesses that have already gone through and certified as Lubbock Safe. And that's just this morning since 8:30 when we put those that up. So it is getting good traction.
Very good. Thank you, Mayor. We actually have one more question, and it was submitted by Karen McKay from KCBD. And so I have the question. It's very similar to Matt's, Dr. Cook, so you may have already answered this. But her question.
Karen is on the line.
Oh, great.
Well, I'm on the line, but I'm also on the air,
Okay.
Dr. Cook. So if you could let Abby read the question, please.
Okay, so here's the question that was submitted by Karen. It says, what is the value for the person getting the antibody test if that indicates exposure? And especially if we don't know if that means this person is protected against the virus. We don't want to give people a false sense of security if they think they've been exposed.
Sure, Karen.
And you may have already answered this.
Yeah, Karen, I don't know if you heard the answer from that I gave Matt. So I feel privileged to be on two different airwaves. So the answer here is maybe it might provide immunity. The studies, they're doing the studies now to see when we build antibodies to this virus, sure, that the whole purpose of that is so that we don't get it again, or at least protect us in the short term. Only time tells, as I mentioned earlier, like the flu virus mutates very fast. And so we have to get a new flu vaccine every year. However, if you get chickenpox, measles, polio vaccines, those last decades. We would like to hope that this IgG antibody is going to last a long time, but we'll have to wait and see. They're doing those studies now. So at least on a short-term basis, we believe that it probably provides a short-term immunity. We just don't know how long.
Thank you, Dr. Cook. We don't have any more questions right now. And so we can close the press conference. And so we're asking everybody to keep up with our website and follow us next week. Is there any other final comments from our panelists?
Abby, I just wanted to, as Mayor indicated, want to make sure that the citizens had the number to contact the health department with regard to scheduling appointments for testing, specifically those that are part of the new group identified by the CDC. That number is, and I have it down, 806-775-2933. 775-2933. And for those of you who are from District 2, you know I bark out the number 311 if you can't remember anything else. So I encourage all that can and desire to take part in getting those tests utilized.
Abby, I'd like to take this moment also as well, just to translate that number, which I've already repeated once already, but I'll say it in Spanish one more time. El número del Departamento de Salud aquí en nuestra ciudad es el 806-775-2933. El número otra vez es 806-775-2933. Llame a que le den el examen de la coronavirus absolutamente gratis. Gracias. Thank you.
Thank you, Councilman Chavez, and thank you, Councilwoman Patterson-Harris, for joining us today. If there's no other comments from our panelists, we'll see you guys next week.
Thank you.
Thanks.
Thanks.
Thank you.